Hi, my name is Avinoam Lerner. I'm a clinical hypnotherapist and a cancer trauma recovery coach. And for over 20 years now, I've helped patients with many different types of cancer thrive during their medical care. Now, when we first hear those three powerful words, you have cancer, our whole world turns upside down. Everything changes. But cancer, as we now know, it affects a lot more than just our physical body, right? Yes, treatment is of course done to our body. That's the job of our medical team. That's the job of medicine, to take care of our physical body. But if we want the best possible outcome, we have a job here as well. And our job is to take care of us, the person within this physical body. We're truly fortunate that more and more people are saved today by conventional medical treatment than any other time in history. We're truly fortunate. That's the power of medicine. But we have a responsibility here as well. While our medical team is working so hard to heal our body, our responsibility is to become their ally and work to heal ourselves. That means taking ownership and responsibility for how we think and how we feel. It means acknowledging that there are certain patterns that we have abided by, patterns that became our identity and now may unintentionally, of course, limit our ability to benefit from treatment, to truly recover. Now, if we're open to this process, open to seeing things this way, then the silver lining in cancer is that it can be a rite of passage, a matter of true self-transformation. Integrative oncology treatment means combining conventional medicine with other modalities like nutrition, for example, or meditation, like exercise, supplements, or even acupuncture as partners in our healing process. But I will say that it's just as necessary or as critical even for us to embrace the concept that we can also reprogram our identity, train our brain to thrive, to ensure that we don't fall into victimhood or helplessness and hopelessness, patterns that we know through research can interrupt and disrupt the functioning of our immune system. To do this requires an ongoing commitment, if you will, to envisioning the best possible outcome in every stage of treatment, a practice which I call mindful remission. And mindful remission offers patients two significant resources. The first is in-person, one-on-one, highly individual sessions that are designed to identify, address, and resolve those mental and psychological patterns that research has indicated can undermine our treatment efficacy. That is resource number one. The second resource is an 8-week online program which is goal-oriented and result-driven. It offers patients practical tools, techniques, and strategies to help them prepare for and recover from surgery, chemo, and radiation. These are tools, techniques, and strategies that can help them become more resilient, if you will, more empowered and confident, so they not only get through treatment, but they will thrive during treatment, enjoy high quality of life. And whether patients work in person or online, they will learn several skills. The main one, they will learn the essentials of hypnosis and self-hypnosis, a vitally powerful resource for uprooting the root cause of patterns like fear and suffering, despair and overwhelm. So they can recognize their own agency, feel empowered, and see the truth about them, that they are so much more than simply their disease. Because the battle against cancer, it doesn't have to be aggressive and full of suffering. It can be a strategic battle to regain a sense of self, to feel more resilient and empowered, so that you can truly thrive during treatment. And we know that this is doable. We know this is possible. We know through research that going into any medical procedure in the right state of mind will yield fewer complications, shorter hospital stay, faster recovery rate, and overall a better outcome. And the true power, from my perspective at least, of mindful remission is that it helps patients reclaim some control over their healing journey by truly training their brain to to thrive. Now, based on my 20 years of working with cancer patients, my view of illness is that it's not some form of punishment, but rather it is a call to action, a call for us to begin to live more authentically and more aligned with our true core values. This change in mindset, it's not just meant to be utilized before and during treatment. It's going to serve you for the rest of your life. And our goal, the goal of this practice, the goal of this program, is not only to survive cancer, but rather to experience more confidence, more comfort, and more joy every single day as we go through this process. I look forward to working with you on your own healing journey. Thank you for watching.